Good morning. My name is Dwayne Price. I am with First Baptist Church, and this is week 5 of our series on mental health in the church. And I have the pleasure to introduce Leslie Cohn with the National Alliance of Mentally Ill and Nancy
National Alliance on Mental Illness.
National Alliance on Mental Illness.
There'll be a quiz afterwards.
There's a quiz afterwards.
Oh boy.
Leslie has held this position for the last 15 years as the executive director for the Blackhawk County area for the last 14 years, and she will be speaking. And Nancy will also be speaking and share her personal experience with mental illness. So, with that, I turn it over to these two fine ladies.
Thank you so much for having us, and I'm usually pretty loud even without a mask, so hopefully people can understand me. And generally, I have Nancy speak first because she's way more interesting than I am. No, I'm not joking on that one. But also, you've had, gosh, we're like the last hurrah. And happy Halloween, everybody, by the way. Appreciate you wearing orange. So I know that you guys have, if you've been coming to some of these, you've already, I don't want to necessarily repeat everything you've already heard the last 4 weeks. So I'm going to have Nancy share her story first, see if you have questions for her, and then I kind of fill in if there's time left over. And I know that we end at 9:50, because there's service. And Dwayne is handing out the bond evaluation forms. Talked about all the stuff I get to do. One of them is grants and grant reports. So these are completely confidential. And they just have a number and some simple information to fill out. But they help me keep track of our activities so I can report them so we can keep the agency funded. That's one of my activities. Otherwise, I'm going to turn it over to Nancy.
Hi.
Hi.
I enjoy life now, but I didn't always enjoy life. I didn't enjoy things like Jeopardy and things like that or anything else. At age 10, I was extremely sad and lonely. I isolated, crying often. Now I know it was something more severe called depression. That means I had a chemical predisposition for it, but I also had a traumatic event that triggered it, which was my mom completely falling apart when I was 12, when my dad left her. And by falling apart, I mean she completely lost it. She was beside herself that my dad was leaving her, and she couldn't be a mother anymore. She just broke down. She became an alcoholic then. I remember walking out of the elevator that morning afterwards on the way to school and figuratively, but almost palpably, putting a bell jar about this thick around myself, saying to myself, I can never trust anyone ever again. And this was before Sylvia Plath put the bell jar. I kept my eyes down and averted that whole year in the 7th grade. In high school, I remained depressed to the point of being chronically suicidal, and then added anxiety into the mix, being terribly fearful of being in groups of people of any size. I still suffer from social anxiety, but with mental illness, you become a master of acting. I mean, I can do things like this, and I can be comfortable in groups of 4 or 5, but like parties and social gatherings, but no one knows because I'm an actor. All this continued dominating my life as I continued acting, acing nursing school, getting married, and having a child. Naturally, I got severe postpartum depression. I called the doctor and said I was going to buy a gun. He suggested I come in instead, and I was started on ineffective antidepressants. I also had debilitating PMS for years, which is typical. That was later treated successfully with natural progesterone. After my divorce at 36, I precipitated by a severe marijuana addiction as I self-medicated to make my pain go away. I was admitted to the hospital mental health unit for the first time. And after about 3 months, transferring from the regular hospital to the state hospital for insurance, I learned that I had to fight depression along with taking meds. After that, I was diagnosed with bipolar 2 disorder. 2 being where the mania is feeling crazy, agitation, racing thoughts, and irritable, and at the same time being depressed often. Now mind you, and take this to heart, I was never bipolar. I was a person with bipolar disorder. And please don't label people as their diagnosis. It's very demeaning and it promotes stigma. The bell jar has been shrunken by the treatment of EMDR by a therapist that learned it from the originator of it, Francine Shapiro. That therapy helped a lot, along with cognitive behavioral therapy and DBT, dialectical behavior therapy. It's about yay big now and with holes in it, big holes in it. In 2003, finally I found a med, this is going back, that helped my depression. It was an MAOI, but I had a severe neurological reaction to it. It was not a side effect that you'd expect, but a completely sideswiped me in my body chemistry, and I experienced aphasia, like I had had a stroke, hallucinations, memory, and cognition loss. That had to be discontinued, of course, and depression and suicidal ideation ensued. After multiple admissions to the mental health unit, I discovered the Depression and Bipolar Support Alliance, DBSA, support groups. That led to going to classes to become a peer support specialist in 2006. There I learned that what recovery was and learned more about self-care and coping with my mental illness and what success was for me. Besides losing my license in nursing, because I didn't know when it was time to renew it because of my memory loss, I was forced to leave being an RN when the neuropsych battery of tests indicated that I had just enough memory and cognition deficit that I was no longer allowed to practice nursing. This was a terrible loss for me that I had to grieve and then reinvent myself, well before retirement age, of course. I moved to Iowa where my brother could keep an eye on me, and I discovered the Peer Support Recovery Center in Waterloo. I told the supervisor there about my training, and he hired me and had me repeat the same training here in Iowa in 2009. I then worked at the Peer Support Recovery Center for 11 years and then moved on to my passion, which was hospice, as a volunteer. I live a full life, including volunteering at Allen, which I had been doing, regular exercise, friends, and dating. I still have to fight the depression and anxiety and take meds for it, and I go to therapy on a either regular or as needed basis. And for the bipolar disorder. But I am in recovery and able to do things like this. But being an RN in IV therapy and hospice has always been my passion, and I miss it terribly. Now I'm going to read a poem for you that I wrote when I was in my lowest in the mental health unit, and I was suicidal. I was just a complete mess. It's called I Can Try. I lose things a lot. I get all hot and bothered when I've looked absolutely everywhere. I never find it that way. I have to kick back and let it come to me, which is very hard, but I can try. I hate getting up in the morning. In fact, I want to stay in bed all day. It is so hard getting up and then showering and dressing, but I can try. Doing worksheets are trying, as I've done them so much and have remained depressed. But one spark may come from one that will make a difference. So I can try. I don't feel cheerful very often, but it helps when I greet people cheerfully, so I can try. I'm in turmoil and don't know how to get out of it, but I can try. It's hard to forgive my mom, but I can try. It's hard to put up with my sister-in-law, but I can try. It's hard to live, but I can try. That's my story.
So you can see why I like to follow Nancy, because that's a hard act to follow. So I did not know if at first people had questions that they'd like to pose to Nancy, and or if you think of them as we're proceeding, just, you know, I don't know how you guys do it here, raise hands. There's not that many of us. I'd love it to be a little bit interactive. Thank you, Dwayne. Yeah, Dwayne knows me, which is, you know, in and out of itself. I don't know what he said before I came here, but I'm worried.
Anyway, I'm open to questions. If you have any, please feel free.
I have one. So you shared that you moved here to be close to your brother. Where were you before you came?
I was raised in Southern California, and then I moved to the Pacific Northwest to be married, when I got married and started my nursing career. And then I got divorced, and my husband moved to Hawaii, and he got custody of my son by mutual agreement because I had the bipolar disorder and wasn't exactly the mother type. And I agreed that he could move there, and I would move there also, to stay in my son's life, of course. And then when he went off to the Air Force after he graduated, I moved back to the Pacific Northwest where the MAOI experience happened, and then I moved back with my brother after that.
Is your mother still alive?
No. She died about 10 years ago. She was 87. Didn't die of alcoholism complications or smoking, but
Yeah,
which was unbelievable.
yeah, really.
Did your family have mental illness
Oh.
that you know of?
Oh, by the way my mom talked, my grandmother did, probably had bipolar disorder. By the way, my sister-in-law talks about her. She knew her when she was a kid. And my mom was always depressed and anxious, terribly depressed, especially becoming an alcoholic, which is a form of mental illness in itself.
Is that handed down?
Yes.
Mental illness?
Yes, it
Yes.
is. It's a chemical imbalance that is handed down genetically, and then you have something that pushes you over the edge into having a regular full-blown mental illness.
The term that they like to use, and it runs in my family as well, and I've dealt with depression and anxiety also, and I think the fact it's really important to share about that stuff, because I think the more we share and the more open we are, the easier it is for people to seek help and realize so many people are dealing with stuff, but are often afraid to say anything because of what Nancy referred to as the stigma. In answer to your question, the term they like to use is genetic predisposition. Well, if you look at any of your family trees or history, everyone has some genetic predisposition to some illness running in their family generally. Lots of families have high blood pressure, or maybe heart disease, or kidney issue. I mean, so it's not just the mental foot. His mask, I think, shrunk in the watch. Geez, I'm like, oh. So with mental illness, and what Nancy said is accurate, genetic predisposition doesn't automatically mean everyone in your family is going to have a mental health disorder. It just means that you may be more prone to it, have a little bit of more of a genetic makeup to make that you may have it. So, and she talked about something to set it off. So the doctors that work, and therapists and everyone who work to help people dealing with mental health disorders, if they're honest, they'll say it's more art than science. There's a lot of factors that come into play with every individual, no matter if two people have the same diagnosis, they don't have the same lives, they're still two different people. So what happens can mean why someone is gonna end up with a chronic mental health disorder that they may be dealing with their whole lives. Sometimes for some people, it may be just one episode that happens during a particularly difficult period in their life, and then maybe after that, they're okay. It's not ongoing or, so there's a spectrum in terms of like with lots of diseases about where someone is when diagnosed and how they're going to do and what their needs are gonna be in terms of treatment. So my grandmother had clearly, even as a small child, I realized something was wrong. Severe chronic major depressive disorder. So that she just wasn't, a lot of times when we came and visited her, it was clear she was barely functional. But there's a lot of people that also have depression that are not as severe as my grandmother was, plus at that point she wasn't getting treatment, like of the kind, and she was being just tranquilized the heck out. I mean, it's like horse tranquilizers, I don't know. She was in Alabama, and I don't, it's only darkly funny, but her doctor was named Dr. Sugarman, which is definitely one of my favorite doctor names. It's very Southern. You can just picture this guy like going, "Hey, here, honey, have some Valium." I mean, there were just jars of it everywhere. So, I mean, she was barely functional because she was so out of it. So I'm like, later I look back and think, gee, maybe if she had actually been able to have therapy and maybe appropriate medication, I would have seen she was just a sweetheart. But, maybe I would have actually had a grandmother who didn't seem like they were just completely out. My mother did not really deal with depression. So there's the generational, she had other issues, but I don't think, that was not one of them. Except when my father died, and then she had what you would call situational depression, which everybody on this earth is gonna have at some point. Your loss of a loved one, divorce, loss of a job, even stuff that's good that happens sometimes can send someone spiraling into depression. But with me, when I had my son, after I gave birth, I had postpartum depression, and I didn't see it coming. And I remember, and it was, it was pretty awful. And I remember my mother going, why is this happening? And I'm like, do you remember your mother? And it was like, oh, yeah. Suddenly like, yes, it runs in our family. We should have been thinking about this, that this could possibly happen. So.
Does anybody have any more questions for me?
Anybody else does? I just have another. I work with young people, and I have students who have been diagnosed with bipolar disorder. What advice would you give to young people who are kind of entering into the world of treatment and support?
Tell people around you about it. Talk about it. Be open to caring. And don't be afraid to wear your heart on your sleeve. People will understand, especially nowadays. Like with my social anxiety, I'll tell my friends if I start feeling really freaked out, I'm gonna come to you and nudge you, and you can say to me, "You're okay, you're in a safe place, people like you," and so forth. You had a question, sir?
Nancy and Leslie, could you guys kind of focus a little bit, this is my question, I guess, on the destigmatization of having a mental illness compared to other illnesses. One of the things that I think is important is, not having that stigma that goes along with it there. And if we don't have that, I think we can go a long ways in understanding each other, as a group of individuals or as human beings, and how important that is to destigmatize, having mental illness, because people hide it. People don't hide having high blood pressure or diabetes or kidney disease. But mental illness, I mean, it's kind of like a taboo.
Correct.
Yeah.
So if you guys could kind of speak on that a little bit,
Yeah.
how bad that stigma is there and how that kind of keeps you down.
It is. I've met a lot of people that will confide in me that they have trouble, and I always encourage them to self-disclose, because the more people self-disclose, the more people will understand that it's not that uncommon, and they'll accept you as you are and help you out, and just like they would any other disorder. Someone will be watching for your low blood sugar if you have diabetes, and will bring us some candy, or whatever. And for someone with mental disorder, they'll be like I said, they'll be, you're okay.
No,
You don't need to be afraid.
There you go. Thank you.
I think, Dwayne, you already partly answered your question, pointing out the differences between certain diseases that people are communicating with each other about and very open, and they're not even thinking about it. They're not hesitating. Should I tell someone? If I tell someone, will they tell other people? Who do I choose to tell? I mean, you can already see the spiral of anxiety and stress that come around that are just not part of a lot of other diseases. And in my longer talk, which you're not, don't worry, not gonna happen. But the story that I like to share is someone refers to mental illness as not a casserole disease. And she was talking about having a younger child who had a mental health diagnosis. And she said she was really scared to share it. And when she did, with some people, they would literally step back from her, like it was catching. And the other thing she said is she would see their faces, and there would be this kind of accusatory look. And basically it was like, what did you do? What did you do wrong? You must have caused this. And then she said it was just palpable. So that drives you back. In this case, it was her kid. She said normally if something was going wrong, she would have talked to all her friends and family members and gotten advice about what doctors they used, what treatments were working. She said her church people would have prayed for her and maybe brought over some food, if they were in a crisis situation, to freeze so her family had meals. And she said, I couldn't find any of that kind of support, and I was afraid to talk about it. And I felt, gosh, this is why. Now, on the other hand, I have hope for the younger generation. My son, when he was in high school, and he's about to graduate college after this year, not good, he was in a psychology class at high school, and the teacher shared that she had ADHD and anxiety, and discussed her own treatment, and other students actually opened up about their diagnoses and were very open about it. And not just anxiety and depression, and that's not to downplay those as serious mental health disorders, but there are some mental health disorders that frighten people more than others, and that are, even I would argue, more stigma around them, schizophrenia being the biggest one that I think people are most afraid of, most confused about, most. So anyway, when he told me that, I said, well, that's a sign of hope to me. Maybe the next generation, like they're more open about a lot of things that ours weren't. Maybe they're going to be breaking down some of that stigma more. Maybe there's some more hope. So.
Did you have a question earlier?
Me?
Yeah.
No, I
I
just
think
got
it
a
was-
sore arm and I'm trying to
Oh,
exercise.
yeah,
I'm sorry.
that's
I'm gonna get
okay.
too personal.
That's okay. I guess I'll ask you guys a few questions then. first of all, who else has spoken here? So I don't know who's come and covered. Have you guys been to the earlier ones? That's not to put you on the spot. I know that,
No, I just said I've been to one.
okay. I know that Tom Ekus from Black Hawk Running Mental Health Center spoke.
Yep.
That's the only one I knew of it. Oh, Dwayne spoke. Oh, well, never mind. Okay, so he spoke about his work. Okay, so is anybody here actually familiar with NAMI? Well, Dwayne, you don't, oh, okay, if you didn't raise your hand, I was in trouble. Yes, you are? Oh, yes, okay. This is like the mask, it's like, who's behind the mask? Do I actually know them? And at first I was like saying to Dwayne, I know you, and then he looked at me and I went, oh God, did I screw this up? And he's like, no, I do know him, thank goodness. So NAMI is one of those great acronyms that and they've changed what it stands for, so Dwayne, not your fault. Like over the years, they've changed it, and now it's National Alliance on Mental Illness, because it's a little broader. It used to have 2 other variations prior to when I was around. And basically there are NAMI affiliates in Iowa, across the country, there's state offices, and there's a national office. And it's what you call a mental health grassroots advocacy organization. It is not the only one that exists. There's another one that's much older called Mental Health America. I think this mask is going. And, but NAMI started in the way of a social movement, which is kind of interesting. There's a documentary about the origins of NAMI called When Medicine Got It Wrong. And there was another story, there used to be a term on the books, there's this giant and ever-growing book called the Diagnostic and Statistical Manual, shortly called the DSM, which is what anyone doing diagnoses and medication management uses to diagnose someone. So there's another difference. So there's lots of diseases you can diagnose, say with blood or another sample. You have an accurate diagnosis and a pretty clear idea of how you treat that disease and that it's going to work. So with mental health disorders, you are basically relying on talking with someone and what they present and what information they give you. And then you're looking in a book and going, oh, they've had these symptoms for this long, I think you have. So Nancy talking about depression, a lot of people are diagnosed with depression because that's what finally drives them in to get help. When they have bipolar disorder 2, which means you're more prone to depression, but you need different medications to work than you would if you had depression. So it's tricky.
Or bipolar 1.
Or bipolar 1, right. There's more than one bipolar. So the DSM is put together by psychiatrists. Gosh, I would not want to be in those meetings. And it's just gotten bigger and bigger. I call it, it's like a weapon now. So when medicine got it wrong, there was a term on the book called schizophrenic mother. So that meant that the person in the documentary who's interviewed said, when she went in, she was told that she was the reason her now adult child had schizophrenia. She was the cause. Can you imagine a doctor telling you that? It's one thing to say family history of genetic predisposition, but no, it's your behavior. And there was no winning for the mothers, and there often isn't. So either you were too close to your child and too on top of them or whatever, or you were too distant and cold. Either way, you had brought on schizophrenia. Now, this woman said, I have 5 other kids, or 6 other kids, I can't remember. Why don't they all have schizophrenia? Why didn't I cause that in every one of them? When parents were getting this kind of information, plus the institutions that people were being warehoused in, that people were really appalled by, they knew that something had to change, and they found each other, and this is the way NAMI started, like advertisements, meet in church basements. We still meet in church basements. So that tradition continues. Or, people's living room, finding each other, starting to share realizing similar things were going on and getting angry. So there's footage in the movie, and of course, it's in California, where lots of movements, or protest movements, and people are marching. People are marching and saying that this is wrong, better treatment, better chances of recovery, just, they're angry. And that was basically in the early 70s. And first of all, the term was taken out of the DSM. Doctors apologized and said, yep, we were wrong, it's a brain disorder. We messed up, sorry about that. And, whoops. And then the first precursor to NAMI was a national meeting in Madison, Wisconsin. So that's where it started, as when I refer to a grassroots mental health organization founded by families seeking recovery and better treatment options, and like not institutional settings, but community settings for people they loved. And today, we're still basically focusing on education and support. So everything we do is free. It is also a supplement to the professional services that people receive and that Nancy referred to. It does not replace one-on-one counseling or therapy or diagnosis or medication management. We're in addition to that. So we have support groups, we have classes, we have educational programs with speakers. Primarily, that's what we do. We're a small local affiliate. I'm the only staff member and have been for 14 years. And everybody else who does stuff for NAMI, like Nancy, is a volunteer. So some NAMI affiliates are much bigger, have more staff. Some are small like us. It's a variety. And that's kind of what we're up to here locally.
You should mention the 2 classes that we
Well, we actually have 3.
3, yeah, that's right.
Right. Right now, part of the thing is COVID has been a real different world for us. So up until March of 2020, everything we did was in person, and that is the only way we operated. And then we had to really regroup and start to try to do stuff online. Now, the classes that Nancy's referring to, there's NAMI Family to Family class, which is for family members or partners of people who have adult relatives with mental illness. That's one class. Peer-to-peer class, which is for people with mental illness taught by others who have mental illness. And for our classes, they're scripted classes offered around the country, created and updated by our national office. So the people teaching it are using a script. They do not have to come up with lesson plans. They bring their own individual spin to things, but it's very different than, so these classes, again, the idea would be no matter where you took it in the country, you get a similar experience by having this scripted class. So, and they are trained, everyone who is a teacher is trained and certified through our state office. Our 3rd class is called NAMI Basics, and it's actually for family members who have a child or adolescent with a mental health diagnosis or symptoms without a diagnosis. So those are the 3 classes we have. What happened though is we normally offer those in person, and we have not been able to for a while. Some of these have been online, and people have been, other NAMIs in the state, they kind of lined up and had teachers who were just more used to teaching online for whatever reason. So our state office said, funnel people who need a class immediately to these other NAMIs and have them do don't start trying, because the requirements suddenly, when NAMI National had to come out and switch, like, what do we do online? They came out with it was like a document that was overwhelming of the requirements that were different than the ones when you do it in person. So I was like, that's good, we can handle that. Meanwhile, we switched our support groups to being online, and eventually I started having speakers do presentations online. So we are still in transition because the church where we do a lot of our stuff has been doing a very slow reopening. They are behind you guys. And they're limiting the numbers of people we can have in the church, which means that we can't do certain things.
Can you explain to these guys there where that is located? 'Cause I
Yes.
don't think that anybody even knows where that's located. Maybe 3 people in this room.
Oh, that's right. We do a lot of our stuff, it's, when I'm off script myself, I don't do as well. First Congregational Church, right near here,
Down the street.
right down the street, is where we do classes, board meetings, educational programs with speakers, generally. I am hopeful that they will be fully reopened with full numbers allowed by March. If not, we're gonna have to find a different location, which is something I don't really wanna deal with. We've been in the church, one of the original volunteers and one of the founders of what was happening here locally went to that church. We've been there over 30 years. That's like our home, so, and they're great. Thank you, Dwayne. It's good, I wish the boys were around to prompt me. So, again, we're doing things to hopefully help support families, partners, friends, people with the diagnosis and lived recovery with their illness do better in addition to whatever they're receiving through professional services.
NAMI does really help. It helps to be a teacher with the peers. I've done the peer-to-peer class, and she's right about the online. It's, the classes are much more effective when you can be in person because it's a very personal type of disorder, and when you talk face to face with people like this, it's more effective. It's more helpful, I think.
Absolutely. So
That peer-to-peer class, is it for adults?
the peer-to-peer class is for adults. We don't, because everything is peer-oriented and the volunteers we have are adults. So that's why we have things for families or people with the illness, but it's all adults. No, we don't have stuff for children and young people, really 18 and older is what we're looking at. So I will try to figure out if there's other stuff out there. And so there are some places that do some stuff for young people, primarily in the schools now through Success Street is, and some agencies do sometimes have groups for young people. So, I mean, there's a need, but we're just not really equipped to do that. The volunteers that I have, I'm leading some of our support groups, and I am an LMSW, which means a licensed master social worker. And I also have been doing this for a while. And otherwise, I have people who've been trained volunteers who are helping to lead support groups or classes. And I can't do that with kids or young people. So it's just kind of the nature of how NAMI's set up. Let's see, we've got, the other thing I kind of mentioned is that, and I think Nancy made that real clear in her story, the mental illnesses are brain disorders. Obviously, it's not the only brain disorder there are. There's Alzheimer's, there's dementia. My husband has Parkinson's disease, that's clearly a brain disorder, but it's a specific brain disorder. So a lot of people, NAMI really likes to do we're gonna use that term mental illness and we're gonna be proud of it. Like, no one doesn't say heart disease instead of there is something wrong with your heart that causes issues. You don't have to make up a new term for it, right? So that's part of the stigma, they would argue. On the other hand, I think you go with what people are comfortable with. So I will use mental health disorders. I don't have a problem with that. I love the term lived recovery, which is much more recent, which is the idea that people are living in the recovery. People can recover. It's very positive. So I like that. But as Nancy said, people should never be defined. No one is defining people by their diseases. They never should. People should be approached as an individual first, whatever else is going on. It's called people first language. It's not just with this, it's used with people with intellectual disabilities or with other issues. You're not defining the person by what you consider something is wrong with them, which is already a problem, or that they're not normal. You notice the air quotes, so. So anyway, the one other thing that NAMI basically says is he calls it a no-fault brain disease. So they're trying to emphasize this is not someone's fault. Thus the biological nature, the chemical imbalance. Yes, there are other factors that can bring on and affect mental illness, just like it can affect lots of other diseases. So yes, if you're in a highly stressful situation, if you don't have enough to eat, if you're living somewhere where there's a high level of violence, there's going to be lots of other factors that, with or without a mental health diagnosis, you may be struggling. So.
You know, I realized that I need to change something in my spiel, and that is that I called my mom an alcoholic. And she was a person with alcoholism.
Ah.
She was ill too. And
Right.
she had very good qualities other than her inability to be, to mother me and to be very unhappy and so forth. She cared, she cooked meals, she wasn't mean, she was a very nice woman. She just happened to drink all the time and be dysfunctional. But she was a woman with alcoholism. She was not an alcoholic, and I apologize for that.
That's interesting. I hadn't noticed that.
Yeah, I hadn't either.
No, that's cool. And alcoholism didn't used to be considered a disease, as people can recall, and it is. Now, people accept that, but that took a lot of work and a lot of education and a lot of changing minds.
Isn't it in the DSM?
You know, with alcoholism, I would probably, the term they use in the field is dual diagnosis. Okay, so that can mean you have what they like to term a substance use disorder, right? We're always these broader terms. So under substance use disorder, it would be alcoholism or any substance that you are using and or abusing, and at the same time you have another, say an underlying mental illness as well. And sometimes people are starting to use what is considered a more socially acceptable and less stigmatized version, which is alcohol, to treat how they're feeling before and then it morphs into something much more serious.
Like I did with pot.
Exactly,
Mm-hmm.
exactly. It's called, oh dang. It's not called,
Self-medicating.
thank you. It's not called all dang. It is called self-medicating. I knew there was a term. I was self-medicating in high school. Sorry, that's probably more than you guys need to know, but yeah, I was definitely self-medicating in high school. So, anyway, yeah, sometimes it actually works for a little while. And Nancy, you're talking about social anxiety. For some people with social anxiety, alcohol does kind of smooth the edges a little bit, like so they can go to a party and not just sit by the dip. But it generally doesn't work over a long term, and it certainly doesn't work for really helping.
And marijuana certainly doesn't help.
No.
It made me isolate and be very kind of paranoid and so forth.
Right. It's interesting, and this is totally off topic, however, they are starting to experiment with what they call microdosing. This is all in the future. And I know we're in Iowa, so I'm not trying to freak anybody out, I swear. But not everything that gets termed as bad, a lot of medications that have turned out to help people with mental illness have actually been first used for other things. One of the best drugs for bipolar disorder, for a mood disorder, mood stabilizer, gosh, I can't remember what the other use was, but they
Anticonvulsant.
Thank you.
Yes.
So they were giving it to people for that, and suddenly it's like, gadzooks, we have something that actually helps something else and has a low, I might add that with the other thing with mental illness is that when people talk about the side effects from the medications they have to take, they are not just, as my people would say, fetching or complaining, it's real.
Mm-hmm.
basically everybody on psychiatric medications that I know is pretty much weighing, can I deal with the side effects? Is the medication good enough to help me that I can deal with some onerous side effects? And there's almost always side effects.
And it takes forever to get the right medications.
Right,
It just, trial and error, you know.
right.
There's no blood test for the right medications.
They can,
It's very frustrating.
right, they started being able to sometimes, they may be measuring blood levels to make sure that sometimes to see if something's getting in your system or if something else is getting out of whack because of the medication you're taking. So they may be watching thyroid or liver function or,
Where some of them can show toxicity,
correct.
like lithium and Depakote.
Right, and oh, yeah, I knew someone, I mean, that was the fear, someone who had been on lithium for years and it had helped with their mood swings and they had been pretty stable and it had wrecked their liver and they were gonna have to go off it and they were so frightened because they were like, this is a medication that's worked for me and now I'm older and we're gonna have to try something else and who knows. And that's the other frustration. You can be on a medication that's working great and then it just stops working. And again, that's not typical of a lot of standard protocol, or Nancy's the ex-nurse, she knows the terms more, but like if you're on a medication, our friend who has high blood pressure, has been on the same medication for years, it keeps working. He's not waking up tomorrow going, dang, is this medication gonna stop working? There are, someone who was doing great for 2 years on an antidepressant and then it just stopped working. And then they had to start all over again.
I don't mean to correct you, but
Yes,
there are a lot of medications, blood pressure medications,
okay,
statins,
okay,
that people crash on.
Oh,
When-
do
when I-
they?
When I say that,
yeah,
they work for you for a while, they might work for you 5, 10 years, and
Yeah.
all of a sudden your lip starts to swell, or your tongue swells up on you.
okay.
And it's like, okay, we're gonna try you on something different there. So all medications are pretty much,
Okay, so that's more standard
it's
issue.
more standard than a lot of people think there, so.
No, I think that's actually helpful. I'm just around people who are dealing with mental health medications, so I hear their side of things,
Mhm.
as well as having family members, both living and dead, like you, that have had mental health issues, so that's my sort of familiarity. We're actually at the 10 to 10 mark, and I think you guys wanted us to end now, so I didn't really want to go overtime, because
I did want to say that,
3 minutes.
I did want,
3 minutes.
okay, well, let's.
oh, okay, well, I did want to say that I'm open to phone calls or emails. If anybody wants my phone number or email address and has questions from someone that's been there, I'm more than welcome to, you're more than welcome to contact me.
Yeah,
So just come up and ask me for it. I'll stay here for a few minutes and.
yeah, and I also, I don't have, that's, my work life and my other life have become very porous. So, I take, I do calls and make myself available in the evenings because people work, weekends if that's the only time, so similar to Nancy, I am happy to help and talk. There was one hand in the back. Hand in the back?
Just a quick question, where does ADHD fit? Is it a mental illness?
Yes,
Okay.
yeah, it is. I mean, it's considered. I guess that was the shortest answer. I'm obviously incapable of short answers. It's not my strong suit.
I just want to say thank you both so much for coming and taking time out of your weekend to share with all of us. And Nancy, your story is such a story of hope, of human perseverance. And so thank you so much for lending your life to all of us and to all that you impact through the teaching of family.
Absolutely.
Thank you.
She's awesome. That's why it's always much better if she's with me and I'm not just talking by myself. I appreciate people doing the evaluation forms and passing them in, and again, if people have, I think your service starts at 10 though, so I know you guys are.
10:15.
Oh.
So I'd like to thank Nancy and Leslie for coming in and speaking today. There are resources out in the community. The Peer Support Recovery Center is 626 Commercial Street, which is the old Edward Jones building, so it's easy for lots of you guys to remember.
And it
There's
says
also,
hospice
It
about
does
It
say
says hospice over the
and
top of it
I was
there.
gonna say it still does.
so,
There's also
There's-
Elevate.
also Elevate Center, which is also a Peer Recovery Support Center, and they're relatively new to the community, and they are above
Screaming
the
Eagle.
Screaming Eagles downtown, which is Lafayette and Fourth Street.
Fourth Street. Just,
West of East Fourth Street, and it's a drop-in center.
yeah, there is, however, well, they have peer support groups at certain days and times
Yep.
in the late afternoon to evening. I will say theirs are more for substance abuse and mental illness, so they're more dual diagnosis, and I'm speaking for someone I know who's gone on a very regular basis. So she said, the difference is theirs is late afternoon and evening.
Yes.
Peer Support Recovery Center is during the day.
Yeah.
So that it kind of depends on someone's schedule, and that's really more exclusively people with mental health. The one at Elevate, they also have a group for veterans, a separate group for veterans as well. So they have some other groups, and it's all grant funded, so it's fairly new, and they're doing a lot in the community.
So it's very important for you to support those things there, either by calling in or participating, because if you don't do that, then they don't think you really need a grant, or there's a need for it in the community, and that's not necessarily true. So don't be thrown off by some of the language that you hear. Leslie still calls dual diagnosis, which is in the DSM-4, meaning that you have mental health, mental illness, and substance abuse. We call that co-occurring now.
Oh,
because
that's
in the-
right,
we're in the-
co-occurring disorder.
we're in the DSM-5 now,
No,
so,
I'm
and
saying-
that's okay.
I'm
That's okay.
ashamed, I forgot.
So
I tell you, I really, could they just keep some of the terms the same, man?
they keep none of the terms the same, but they mean the same thing.
I know, and
so.
you're right, and
yeah.
it's like the code, I got it so Nancy, I had to fix that. In my head, I've used that for so long, it's hard to.
But we've been around since the original DSM was developed in 1952, and we're on the 5th edition
Yeah.
with supplements in between. So we're actually, probably the people in this room have seen all of this develop over the last 70 years, well, 69 years. So, I mean, it's very important you become familiar with that because it kind of governs our life. It's been kind of a work Bible for me to understand what's going on with different individuals and how to work with them, how to work with their medications with their doctors, and how to be effective. So once again, I'd like to thank these two fine ladies there for coming today, and this is the official end of Mental Health Month in the church, but mental health as a whole, we need to always work to recognize what's going on with ourselves there and address it, because if you don't address it, then it takes great toll on you. So once again, thank you for coming.
Thank you. Don't forget, I'm open to questions and everything. If you want my number or email address,